Yeah, Michael, thank you. Hey, welcome everybody. This is Technologies Work Group, and today we're honored by the presence of Softheon, who will be taking the topic of distributed streaming. Uh, Joining us today is Eric Driscoll, Softheon's head of technology and interoperability, and Akshay Mathur. Hope I got you that right, Akshay. Who's Softheon's group product manager. They use distributed streaming within their product set. So they'll share a little bit about themselves and then get into the technology. If you are familiar with the subscription type model, where you ask a computer to say, hey, I want to listen to something, and then they come up with, say, status information, like, for example, in Fire, where they go ahead and say, I'd like to know what my status of my prior authorization, and it comes back and says it's being processed, and this is the solution, or this is the answer. So one-to-one type of a streaming type solution. But think about it from a community perspective of being able to stream, not necessarily in the Fire world, but and then more of a computer to computer sort of an event where you don't just subscribe to one computer, you subscribe to a community. So Eric and Akshay, I'd like to take it over to you for about a 30-minute conversation, and then we'll open it up for some questions. And if you'd like to monitor the chats and answer while we're going, that'd be awesome too. Thank you.
Awesome, thank you. Then let us know when we're good to get started. Hopefully everybody can hear me all right here, and we'll go ahead and start sharing our presentation.
Sounds great.
All right. Give me 1 second to get that up for everybody. All right. And then can I get confirmation really quick that everybody can see the PowerPoint?
You're good to go.
All right. Well, thanks everybody for giving us this opportunity to talk to you guys today. We're very excited to spend a little bit of time with you to share about kind of our journey with distributed streaming for the healthcare ecosystems and interoperability. So to give you a little bit of background information on us, let me make sure that my little clicker here is working so I can go to the next slide. All right. So my name is Eric Driscoll. I'm the head of technology for interoperability here at Softheon. I've been with Softheon for just about 9 years at this point, so I'm excited to share some of the insights and things that I've seen on that journey. And I'll go ahead and hand it over to Akshay to introduce himself, and we'll jump right into it. Akshay?
Sounds good. Hi, everyone. I'm Akshay Mathur. I'm a group product manager at Softheon. I've been at Softheon for about 4 years now and have been focusing on interoperability. Let's move on. So starting with a little bit about Softheon, Softheon offers SaaS and BPaaS solutions designed to address complex operational and service challenges faced by health plans and government health agencies. By leveraging our solutions, health plans assist individuals in finding the right coverage, keep members engaged, and empower them to make healthier choices. So moving on to interoperability at Softheon. So as part of our product offerings, interoperability is a big focus, and we connect with public and private exchanges as well as major insurance payers. Through this, Softheon supports over 100 health plans, ensuring a seamless and integrated experience for all stakeholders. So various health payers and carriers are leveraging Softheon's interoperability solutions to streamline the payment and enrollment process for health insurance. So at this point, I'm actually going to transition and dive right into what are some of the biggest challenges faced by healthcare industry, and particularly those related to interoperability. Starting with data silos. Data silos are one of the biggest challenges, and according to Harvard Business Review survey, 84% of executives report suffering from negative effects of data silos, which occurs due to data fragmentation within and across the organization. This data fragmentation stops the insurance payer's ability to get a 360-degree view of their members, making it really difficult to provide a more personalized experience. The problem of data silos in healthcare ecosystem is huge, because in healthcare space, disparate systems and stakeholders integrate to provide healthcare services, and now especially due to the increase in trend towards distributed systems and shift towards decentralization, such as more and more state-based marketplaces, increase in private exchanges due to ICRA, and even different claims processing systems managed by multiple health payers, costs of managing healthcare data is increasing. And due to operational inefficiencies as a consequence of data silos, healthcare companies have to pay millions of dollars to manually manage their operations. And more than often, it leads to poor member experience. Scalability and delays in data processing are two other big challenges that have significant financial impact on US healthcare industry. So for the next few slides, we will actually focus on these challenges and talk about how Softheon is leveraging distributed streaming to address them. And then we will come back to data silos and talk about Softheon interoperability solution to address data silos along with other two challenges. Scalability challenges in healthcare is increasing due to data explosion in the industry. Healthcare sector is experiencing a rapid increase in data generation, which requires scalable solutions to manage and analyze this information effectively. According to a study, by end of year 2025, the compound annual growth rate for healthcare data will reach 36%, outpacing many other industries such as manufacturing or financial services. Trends which are contributing to data explosion are digitization of healthcare data and automated workflows, increase in enrollments. CMS open enrollment report shows year-over-year increase in marketplace enrollments. Between 2021 and 2025, enrollments have more than doubled, as you can see in the graph. Also, the growing integration of AI and machine learning into healthcare workflows is significantly increasing the load on the data pipelines that connect distributed systems. So as these systems become more and more complex, we are also witnessing a rise in IT failures that disrupt healthcare supply chain. Notable examples include the 2024 Change Healthcare outage, which halted claims processing and payments for months, and global CrowdStrike's outage severely impacted healthcare services worldwide. So let me double down on these instances. These outages or delays in data processing, particularly associated with premium billing and claims processing, negatively impact cash flow and revenue for payers and providers, and lead to higher denial rates for consumers. So this not only results in financial losses, but also negatively impacts the member experience. Patients may face delays in receiving necessary care or resolving billing issues, leading to dissatisfaction and potential loss of trust in healthcare services. So scalability, fault tolerance, and real-time data processing in healthcare is a necessity, not luxury. So now that we have learned about some of the biggest challenges in healthcare space, I actually want to talk about how Softheon is addressing these challenges, starting with scalability and delays in data processing. For scalability and real-time processing, Softheon is leveraging distributed streaming technology and using Kafka as a distributed streaming platform to process enrollment and billing information in real time and stream these critical member-associated healthcare data through different disparate systems in real time. So a little bit about Kafka. It's an open source distributed event streaming platform designed for building real-time data pipelines and also streaming applications. It was developed by LinkedIn and has been adopted widely in various industries. For example, in financial services, Kafka processes transactional data in real time to detect fraudulent patterns. Kafka is used by stock trading platforms to stream stock market data for high-frequency trading. So at core, Kafka provides scalability and fault tolerance by handling massive data volumes efficiently. So at this point, I actually want to hand it over to Eric to dive into some of the core components of Kafka and also how Softheon has incorporated Kafka as a distributed streaming platform for real-time data processing.
All right. Thanks, Akshay. So we'll kind of jump into it here. I wanted to not spend too much time on this slide, but I really wanted to give everybody kind of a shared dictionary here as we're talking about event streaming platforms. And I think using Kafka as an example will help kind of understand some of the pieces of that system and how it's breaking down those different challenges that we're looking at. So really quickly to go through this, for those of you who are not familiar with the Kafka infrastructure, it's broken into a few key different pieces. The first of that is producers here. And producers are essentially going to be responsible for getting information into the system. And on the opposite side of that, consumers are going to be taking data out of that. And so to go into that a little bit further, producers are going to be, again, this is asynchronous event-based communication. So we're going to be getting those events. The producers are going to be essentially putting that onto those topics, and we'll talk about exactly what a topic is in a second. And then the consumers are going to get notified that a event is available, and it's going to pull that off and do whatever processing is necessary on that other side. It's important to note when we're talking about these that producers and consumers are not talking directly to one another, right? That's kind of the paradigm you see with other technologies like APIs that you're probably familiar with, where service one is talking directly to service two, and it requires both to be up and fault tolerance and scalable at the same sides to be able to process that. With this, each of those pieces are independent. The producers aren't going to be talking directly to the consumers. Producers are just taking that information, putting it on the topic, and then consumers are being notified that it's available, and they're going to pull it out of there. I see somebody saying, are you using a pub submodel? And yes, we are for that. So we can talk about that a little bit more as we go into some of those examples here. So topics to go into the next piece of that are really kind of your database tables here. They're not exactly a database table, but I think that's an easy way for a lot of people to understand it. One of the main reasons that it differs from a database table is it works off of what's called an append log. And essentially that is going to be keeping track of those events in the order that they occurred and were processed through that system. And that comes with some cool built-in features like being able to replay events from a certain point of time as long as within your retention policy. So as an example, you might have consumers that are pulling off of your Kafka topics. They might be doing some transformation of that data and putting it into your database. And let's say that maybe you have a bug on the consumer side of things, and you're doing that transformation wrong. You put a bunch of bad data into your database. Assuming you have the ability to clean that up, you now can also go ahead and replay all of those events from that Kafka topic from whatever point in time from before you started having those bugs, and then can get all of that data into the correct format and process from there. So that's one of those key differences and one of the things that makes Kafka really powerful here versus some of those traditional methods that you're familiar with. So kind of building on top of that, scalability is one of those important things that we're talking about here for producers and consumers. It's important to note that you can kind of scale those individually from one another, and that's mostly through using partitions. So topics can be divided into partitions, which adds essentially a degree of parallelism. We don't need to go into all the nitty-gritty, but it's important to understand for the scalability of these systems and why distributed streaming is so powerful, that you have the ability to scale kind of each of these different pieces independently. Then to kind of pull it all together, brokers are going to be essentially, you can kind of think of them like the server. They're going to contain those partitions and topics within them, and they're going to kind of handle the disk IO, the network. So again, when we're talking scalability, depending on where your issues are, if you need to get more data into the pipes, you can scale up producers and partitions. Need to get more data out of the pipes, you can do that on the opposite side with consumers. And if you need to scale up the bandwidth of the pipes, you can add additional brokers into the mix as well. And then that comes with some benefits as well as built-in fault tolerance. If one broker goes down, Kafka has the ability to take essentially the messages that it was processing and hand those over to another broker. So you get that built-in fault tolerance and scalability there as well. And then clusters are really that grouping of everything together. So hopefully that just gives a high level overview of the different pieces of Kafka so that we can talk about some of the use cases that we're seeing being beneficial here. So jumping into that, I wanted to give a high level architecture overview of what an enrollment processor might look like in the Softheon system, and some of the ways that even on the smaller scale, we started using Kafka and event streaming to really improve the processing power of our system. So one of the things that what I'm showing here essentially is you might have some sort of API or UI to get those enrollment events into your system, or maybe you're working with a state exchange and getting directly daily 834s from them. Those might go and get processed through individual microservices here. So just as an example here, we have like a catalog service, which might be managing your QHP benefits, plan catalog, those type of things, a membership microservice to help with that membership processing, and then maybe some things around premium billing services, invoicing notices, and collecting and processing those payments. And each of those microservices are backed by their own database. And in the past, we were doing our writes and reads essentially to these different ECMs, which is entity content management in our architecture here. So each of these different databases, we were doing both our reads and writes. And one of the first things that we were able to do is separate that out into a CQRS pattern. And for those of you who aren't familiar with that, we don't need to spend any time on it really. It's just command query responsibility segregation. And what that means is essentially you separate out your reads from your writes in your database and have those served from different sources so that you can optimize them both independently for what they're used for. So by removing the reads out of this and taking out those indices, we can now get faster writes. And then those will produce events off of change logs and topics for the data that we want to sync over to our entity data warehouse in near real time. And then we build read views off of that and make those available to our microservices on the other side. Are you eventing based off lists, i.e. groups of patients or per patients? That's a good question. It really depends on the use case here. When we're doing our processing, most of these are based on enrollment transactions for a system like this. So those are going to often be individually, or maybe that member, subscriber, and the additional members that are associated with that. So hopefully that answers your question there in the chat, Chris. So again, essentially what we did is we separated out those reads and writes here using Kafka and event streaming in order to be able to focus these databases really on being efficient for our writes, and as well as being able to make our reads more efficient off those EDWs, being able to create the needed indices and stuff on here without slowing down that write. So that's kind of one use case we saw. Another kind of side effect of this, we talked about data silos, and we'll get into that more in the other slides, but by centralizing this data and exporting just the events that we need, we can also build queries that are views based off of these different databases through single requests, where in the past you might have to reach out to APIs or services individually using IDs to connect that data. So speeds up a lot of our reads, speeds up our write, makes the access to data much simpler by having that command query responsibility segregation and streaming that data in near real time. And again, that's an important piece of this. This wouldn't be possible if there was a massive delay in getting this data over, but using Kafka and distributed streaming, again, we're able to kind of speed that up and make sure that that's happening in near real time by scaling out those producers, consumers, and brokers as needed. The last piece of this I wanted to talk about really quick is using it for like a logging service. So one other thing that we really saw and noticed is logs are highly variable within our system. And I think likely this will be something that you guys have seen and might be able to, relate to, where under non-peak loads, when the system's working well, there's not any major bugs or issues, you might see a very low stream of logs going into whatever, back-end system that you have to aggregate and view that data. But during peak loads, if there are issues and when things are going wrong, you might be scaling from hundreds or thousands of logs and traces, telemetry data a minute to potential, or an hour to maybe millions, right? And so that scale, with the way that things were set up before, where that was all hitting a direct API and each of these services are reaching out with their logs independently, you can see how that becomes a little bit of a mess. You start to see degradation in this performance as each of these individual services are all communicating with this API, and the degradation of performance appears. We might get delays in logs. We might lose logs in those transactions. And so what we did essentially is create a buffer using Kafka so that we can stream our logs into a central Kafka cluster and then have consumers pulling off that and controlling the intake into our Elastic system, giving us more scalability outside of just, okay, can we load balance this with multiple web servers? Can we, scale up the CPU and compute on this to hopefully keep up with whatever the max load is? But by using Kafka and being able to control that flow better, at worst, we might have a little bit of lag time in here as the consumers catch up, but with the auto scaling that's built into Kafka, you can really break down those scenarios. So I wanted to kind of give this as kind of a low level example, and I'm going to hand it back to Akshay here for a little bit to talk about those silos, and then we're going to blow up this picture into a larger ecosystem and talk about how we can break down those silos and what are some of the benefits with that. So Akshay, handing it back to you.
Thanks, Eric. Okay, so now coming back to the data silos. We just talked about data silos are a common challenge in many organizations, including health insurance companies. These silos occur when different departments or systems store and manage data independently without sharing or integrating it with other sources. So this leads to data duplication, inconsistencies, and a lack of visibility across the organization, ultimately hindering collaboration and resulting in delays and errors during member enrollment. For example, a case study was submitted by Covered California, which is associated with its data integration effort. Covered California is a state-run health insurance marketplace established under ACA. To address these challenges associated with data silos, Covered California collaborated with Department of Healthcare Access and Information, or popularly known as HCAI, to ingest hospital discharge data. This initiative aimed to enhance the accuracy of enrollment projections and premium rate settings. So Covered California has been able to leverage the unique data collected by HCAI to provide a better picture of health plan risk during the annual certification of qualified health plans. So overall, the integration allowed for improved risk assessment. The access to comprehensive data enabled more precise estimation of new enrollees' health risks and estimating the number of new enrollees with chronic conditions, facilitating better premium pricing. It also allowed for premium stability. With accurate data, health plan actuaries could reduce uncertainty margins, contributing to more stable and potentially lower premium rates, hence more premium stability. So overall, Covered California had lowest gross premium rate increases in year over year compared to other marketplaces. So this demonstrates by breaking down data silos and fostering data sharing, healthcare organizations can enhance enrollment accuracy, streamline premium billing, and improve overall operational efficiencies. So now moving on to the Softheon solution. So to tackle these data silos, Softheon implemented its own master data management platform. By centralizing and governing critical business data, Softheon MDM ensures that all departments and systems across different organizations have access to consistent, accurate, and up-to-date healthcare information. Softheon MDM helps reduce redundant data by creating a single source of truth. Hence, it helps in eliminating data duplication. It also ensures accuracy and consistency across all systems to help improve the data quality. It fosters a culture of data sharing and integration, helping in enhancing collaboration. And it also automates workflows and improve efficiency. In result, helps streamlining the operations. So now, as we have talked about data silos again and briefly talked a little bit about the Softheon MDM, I'm going to actually hand it over back to Eric to dive right into or get into the weeds of the Softheon MDM implementation. So back to you, Eric.
All right. Thank you, Akshay. So hopefully everybody can hear me. And I do apologize. I know I have a bad habit of speaking very fast when I get excited. So I'll try to keep this tone or the speed slowed down a little bit on this one. So apologies for anybody who might have struggled with the speed that I was speaking earlier. Apologies for that. So looking at this, right, I wanted to take us back into those examples and kind of give us a further zoomed out view of a healthcare ecosystem, now introducing this idea of master data management into the system. And so there was a few key things that we were really trying to solve by introducing an MDM. And I kind of want to go through a couple of those use cases to help kind of exemplify why an MDM is beneficial and how we helped break down some of those silos and what are some of the benefits or new possibilities that we have by doing this. So it's important to note on these for this ecosystem or for this diagram that we're kind of trying to display. These are kind of internal systems to Softheon, right? The FFM states, SBM states, ICRA off exchange, and this MDM. And these that you see on the outside here might be an example of an external integration that we're setting up within our MDM to help democratize that data a little bit. So the first use case I want to talk about is really breaking down that silo of enrollment processing. And what you saw in that old in that other diagram was, like I said, an example of maybe what an enrollment processing system might have looked like at Softheon. And in the past, when we had larger carriers or carriers that grew to large size, this might be supporting 30 plus states or markets, which becomes very complicated, especially as we've seen things like Virginia convert to an SBM and change the way that they want to handle recon, or even just the, small differences in processing expectations for something like Arkansas private option, right? It starts to get very complex. And so one of the things that we wanted to do was separate out that enrollment across multiple environments to help reduce that risk and isolate those populations within systems that are really focused on the problems that it's trying to solve. So in order to do that, we needed an ability to still democratize that data and keep it all in sync. As an example for that, one of the key pieces of an enrollment system is being able to identify members. And so we used to have a member match service that was within our enrollment microservice, and we moved that into the MDM so that we can support a larger ecosystem for doing member match. And kind of what that's allowed us to do is create a central identity for each of these members, which gets tracked across these different environments. And we're able to provide views and data out of this MDM to give you the full picture without creating additional silos when we separate out these environments. So things like operations aren't going to have to go to 30 different portals to be able to service these members. And then on top of that, one of these things that we've introduced are things like the external integrations. And so we had a carrier come to us and they wanted to be able to sync the Medicare data into the MDM so that we could do enrollment processing off that. One of the things CMS has kind of talked about in the past with us is the need to maybe reduce some fraud in the area where people might be enrolling in both an ACA subsidy and going for a Medicare plan. And so by adding this Medicare information into the MDM, creating a couple of topics here to be able to sync information like key member identifiers, like first name, last name, any sort of coverage time periods, from this period to this period, they had this sort of coverage. By providing that to the central MDM and providing that through a central service to our other environments, we have the ability to use that in our processing. As an example, you might be able to now set up a rule that says, if a person is identified to have Medicare coverage for the enrollment period that they're trying to enroll for, let's flag that for manual review. Let's have somebody do member outreach, make sure that they understand, what those kind of situations lead to. So that's kind of that first view. And then the second thing that we saw by being able to introduce that data is really this idea of cradle to grave view for those members, a single member journey, right? So you might have somebody that's born and goes on their parents' plan in an FFM state. They'll get added as a dependent onto that plan, and that will eventually get synced to our MDM through an event. That data will be made available, and at some point they're going to turn 26 and age off their parents' plan, or maybe move to a SBM state and get insurance there, but we still want to be able to identify that member. So again, by providing that central member match service, we can identify that this is that same member, provide that same journey, or be able to provide that member journey view to the operators of the system and the people that are providing care for them so that they have that data available. And then eventually they might find themselves in that Medicare environment, even though it's not hosted by us, still on that carrier environment, still within that healthcare ecosystem that we're trying to support. And we'll be able to get that data into the MDM to, again, provide that central view and give that whole journey of that member cradle to grave. So that's another kind of silo that we've seen here that we're really trying to break down, is allowing those event streaming for similar things where it might just be key identifiers and coverage periods, which are, I think, something that most of these enrollment platforms can boil down to. You can centralize that data and democratize it and make it available to everybody in near real time. So that's one thing I wanted to highlight here as a use case. And then the second one really is something that we got asked a lot, is to move away from that daily 834 file. So for those of you who are more familiar with enrollment processing in the FFM or SBM states, a pretty common paradigm is that the exchange sends you a file once a day, you do your processing, you generate an external 834 file, and you send that over to the carriers. Then hopefully they have some process on their side where they can take that data, go ahead and do whatever manipulation they need to get it involved and introduced into their claims or billing systems, or maybe just reporting. And so instead, what we've been doing is emitting events from our different enrollment systems through our MDM and making those events also externally available to our carriers for things like claims processing, billing, and reporting, in order to provide better care for their members, be able to get that information in near real time instead of having to wait for that daily 834 transaction, as well as whatever processing is, required after that. And really make sure that you guys can get people the access to care in a quick and efficient manner. So I think those are some of the key things that we were hoping to highlight here. Again, really trying to speed up these environments by being able to introduce additional parallelism by separating out the enrollment processors and syncing those main events to the central environment, as well as, sorry, did I hear somebody's mic? Okay. As well as be able to make that data available in near real time, and break down the silos from these different environments. So I wanted to open it up here to a little bit of a question and see if other people are, seeing similar types of situations where they want to use this technology within their own organization, or places that you guys are already using Kafka and have seen the benefit of distributed streaming versus maybe like a typical API. Not that one is better than the other, but they have their own use cases here. So figured I'd put that out to the group here. Does anybody have anywhere that they've maybe seen this type of technology? I see some language in the chat that makes me feel that people are familiar with it. So does anybody have an example of where they're using distributed streaming within their own ecosystem? We'll give people a second here, a minute here to see if they have anything they want to add to the chat.
Yeah, Eric, I can give you a couple examples, but I'm going to see if others have first.
Sure.
And I'm going to go off on camera for a secon. If anybody can guess where I'm at, you can put that in chat. It's going to be pretty hard to guess. Anyways, I'll take it off camera. What was really exciting to me when I was hearing Eugene describe, who's your CEO, this technology, was that it could involve many companies and not just a one-for-one that you see in an API type of environment. What I've seen previously in a company I worked with called TIPCO, where they had complex event processing, where it wasn't going outside multiple organizations, but it was within an organization talking with multiple applications. So, for example, Delta Airlines, if one of the applications notices that your airplane is going to be delayed, it goes into finding out who's on the plane, finds out what their baggage is, gets everybody rebooked, and gets all the bags put up to the right places, and involves many different applications by spawning off different events to different systems that are listening that are able to react to that, which is a example I saw within an industry. And when something I wanted to kind of talk to you about is when I think of the typical HIE type of exchanges with like CCDA type clinical data where you're exchanging things, one of the hardest things to do is trying to know where your data is. And then once you find it, then you can request it and be able to pull it. But it's actually that find, and having a community being able to listen to, hey, does anybody have Akshay's data, and be able to listen, I immediately have a response. Then you can go ahead and have your own API exchange to do the identification in more of a real-time environment. It's something I was trying to see if you think, you and Akshay think that would be a possibility.
Yeah, that's definitely interesting. So let me repeat that back to you and make sure that I'm understanding the question correctly. You're essentially saying, is there an opportunity to provide some sort of central MDM or some sort of central environment in distributed streaming to allow carriers from different, or I guess different carriers, to all be able to interact with the same underlying population and data set? Is that kind of what you're referring to here?
I sort of, actually, a community of payers and a community of providers, right? That would have the ability to host people's data. And now instead a patient comes in to a doctor and they're interested in finding out, different sorts of who has, this particular clinical record, and to be able to ask the community to see, who has Akshay's data, and get that response with saying, yes, we have it. So then you can do the API after the, after the identification.
Yeah. Okay, I think I understand. So essentially like a central directory lookup for them, not necessarily housing the information, but it's like, hey,
Yeah.
who has Akshay's data, right? You send it some sort of identifiers that provides the ability to look up in the directory where Akshay might be, and then that gives you maybe a URL that for an API that you can call to get that data. Um,
Yes, yes.
yeah. I think that's definitely a possibility. You know, within even like our own ecosystem, that's kind of how a lot of that is set up. There's a central directory within the MDM that we essentially register each of the different ecosystems with some identifier information for like their server addresses, any SFTP sites that they might have, the base URLs for the APIs that we want to access, and maybe in a separate, key vault or something, secure client IDs and secrets. So I definitely think that that is a viable direction if we can get the buy-in for people to be willing to put that central identifiable information, I would say, because you need at least enough to identify the patient. And getting all the PHI and PII clearance, I could see being a barrier to getting that off the ground. Not a stopper, but
Sure.
something to consider.
I
Right, right.
also want
So
to add to that.
go
Sorry.
ahead. Sorry.
Now, I would just also want to add to that, and it also kind of ties back to the one of the use case that Eric talked about. We get like an external members information, for example, a Medicare data. It gets sent into the MDM, and then as part of this use case, like we identify the members in different instances, and we fire the event of like, hey, we have a Medicare information for this member. We send it all the environments where the member may exist, may have an active coverage, or may not have an inactive coverage, and adding, and then also like in the same use case that you were talking about, so that any potential new enrollments that come up, we can flag them. So I think also one of the use cases that as part of our MDM implementation, where we can identify the member, any new information that comes in, we can identify where exactly this member exists. We can track the member in real time and then fire the events to various different instances hosting the member's data.
Yeah, that was helpful, Akshay. I think at the end of the day, across our different state communities, they have, a number of them are very, very tight. Within
Yeah.
the community, you have a number of providers and a number of participating payers, and they want to be able to create an environment that's great for their state or for their community. And just thinking to put forward distributed streaming as a potential for different kinds of applications, like your enrollment or checking for enrollment, or or checking for other sorts of application type data across the organizations. I think it's a really nice level that you can place in front of the APIs, so then you can conduct explanation. Finding out where the data is at is sometimes the hardest, and being able to then, oh gosh, I have it now. I can go with my real-time type exchange.
Yeah, absolutely. I think there is a very strong use case there for being able to set up a central directory that can emit events to any listener or anybody who wants to be subscribed to those events, in order to be able to find members and then use that directory lookup to do whatever more specific data transfers need to be done from there. So I think that's a great suggestion.
Yeah, thank you. I'm curious, people on the phone, please put in your chat if you have any thoughts on that type of a technology for your community, or any ideas that spawns for you.
Yeah, and thanks for sharing. That was a great example. Let's see. I see Janice has another question in the chat. Let me parse that really quick. I had to step away for a bit and missed a bunch of stuff, but are you using this for anything that requires additional consent management or falls into specific data use requirements where just data for X exists here is sufficient? So yes and no is what I'll say for this. I think traditionally, when we are doing these type of engagements, we have all the necessary agreements in place to be sharing that data back and forth. There's not usually any additional consent that's needed. There's no like user flows that are going to require kind of like the FHIR model has, where you can request access to that information. That's not really the use cases that we're using currently. Those are generally direct integrations with the health payers and other organizations that we're working with. I think for the other piece of it, just knowing where something exists, that is a use case that is common. I would say, I think a lot of the services that we provide are around identifying where that member is, similar to the scenario that Ed just brought up as well. So I think the answer to that is yes, we have scenarios where just knowing where the data is enough, but I don't think we necessarily have any flows currently that require that additional authorization. And Akshay, you can correct me if you disagree on that statement there.
I agree.
All right. All right.
I'm curious on the phone if anybody understands how Tefka is planning on providing a service to locate data. And if we don't know that, Michael, I think that'd be a really good question for our QHIN friends as a follow-up. Does anybody know? Okay, I don't see anything in chat. I'd also like to note to Janice that, man, if you can put that in the MHTC environment, you'll be really cool. Just saying. All right, Eric and Ashke, you're awesome. Thank you so much for sharing your use of this technology. I'm really hoping it starts spinning people's wheels within the WEDI community and within regional communities to try solutions or being able to call different sorts of services that are distributed. I think is really, really nice. So thank you so much. We have just want to give an announcement. We are working on coming up with a Da Vinci use case related to searching for remittance advices. Nick, Rideoff, who's on the call, is heading that up. And we also have something that we're working on related to health equity and AI. So those are two different sorts of topics that are coming on. You can see that I'm 84 East right now. So I'm going to take off on my 84 East. And you guys, thank you so much. Have a great week.
Awesome. Well, thank you everybody for giving us this opportunity to present. If you guys want to hear more, please visit us at softheon.com for more details. Follow us on LinkedIn, especially if you're interested in hearing more information about ICRA or these distributed streaming processes. Shoot us an email, connect with us on LinkedIn, and we look forward to hearing more about what you guys are using distributed for in your own ecosystems, and look forward to seeing the growth of this industry in the future.
Yeah, thank you guys. Softheon looks really cool today. Thank you.
Awesome. Thanks, everybody.
Sure. Okay, bye.